everyone, welcome to my channel, and in today's video I'll be discussing management of type 2 diabetes mellitus for MC1 exam, and the content in these notes are taken from John Murtagh's General Practice book. So before discussing the management of type 2 diabetes mellitus, let's first of all discuss the diagnostic criteria. So if you get a symptomatic patient who is coming in with polyuria, polydipsia, polyphagia, weight loss, or complication of diabetes mellitus, then if their HbA1c is more than 6.5%, or in millimoles, it will be equal to 48 millimoles. And if their fasting blood sugar is more than 7 millimole, or their random blood sugar is more than 11.1, then they are a confirmed case of type 2 diabetes mellitus. So either of these values, if it's positive, then and the patient is symptomatic, then you can diagnose them as having diabetes mellitus. You don't need a repeat blood test in case of symptomatic patients. But if the person is asymptomatic and only on a routine screening test, you found out that their fasting blood sugar or random blood sugar or HbA1c is elevated, then you will need another positive test with elevated values to confirm the diagnosis. So you will be repeating either the fasting blood sugar or the random blood sugar or HbA1c to get a confirmed diagnosis of diabetes mellitus. The problem with HbA1c is it's a retrospective test and it shows the level of glycated hemoglobin over the past 3 months. So to get another positive value for HbA1c to rely on, you need to wait for another 3 months, which is not ideal. So usually we go with fasting blood sugar or random blood sugar, and if we can get a repeat elevated value, then we can confirm that the patient has got type 2 diabetes mellitus. Or if the person is asymptomatic and they are on their screening test, then two elevated values from an oral glucose tolerance test also confirms the diagnosis of diabetes mellitus. So oral glucose tolerance test is something, it's like a 2 hours test. So you need to give like 75 gram of oral glucose load to the patient and then check their blood sugar values at 1 hour and then at 2 hours. So if both these values are elevated, then you can confirm that the patient has got type 2 diabetes mellitus. So this was about the diagnosis. Now, regarding the management, the first line management of type 2 diabetes mellitus is always and always lifestyle, because in Western world, 80% of the cases of type 2 diabetes mellitus are because of obesity. So if we can work on reducing the weight and lifestyle factors, then we can potentially reverse type 2 diabetes mellitus. So the first line management is always lifestyle in cases of type 2 diabetes mellitus patient. So you will advise diet modification, weight loss, and exercise regime. And you will arrange a follow-up with the patient at 3 to 6 months. And if their blood sugar level, fasting blood sugar or random blood sugar or HbA1c, if it is still not controlled within these 3 to 6 months of lifestyle modification, only then you will aid metformin. Okay, so metformin is the first line oral monotherapy for type 2 diabetes mellitus. So the first line is lifestyle modification. The first line medication is metformin. But you need to ensure that the patient's GFR is more than 30, because if eGFR is less than 30, or patient has a cardiac disease or hepatic disease, then we can't give metformin because it has increased risk of lactic acidosis in these patients. So after metformin, you will wait for another 3 to 6 months. And if still the patient HbA1c is not controlled, then you will proceed to the combination oral therapy. Okay, so metformin was oral monotherapy, and now you will go to oral combination therapy. So you can select either of these two. You can do either metformin plus sulfonylurea, or you can do metformin plus SGLT2 inhibitors, which are the gliflozins, dapagliflozins, and the DPP4 inhibitors, which are gliptins, so linagliptin or sitagliptin. So you can either go for metformin plus sulfonylurea or metformin plus SGLT2 inhibitor or DPP4 inhibitor. If still not controlled, then you can like go up to 3 drugs. So metformin plus sulfonylurea plus SGLT2 or DPP4. So even with 3 combination drugs, the HbA1c is not controlled, then what you're going to do, you're going to continue metformin, but you're going to withdraw the other agents and aid either insulin or GLP-1 agonists. So GLP-1 agonists are the exenatide, liraglutide. So with metformin, you're going to withdraw all the other agents and add either insulin or GLP-1 agonist. Okay, so the last resort in type 2 diabetes mellitus is always insulin, whereas in type 1 diabetes mellitus, it's the first line treatment. So this was about the management of type 2 diabetes mellitus. If you found this helpful, please subscribe to my channel and share with other people who might need it. And I will see you soon with the next video.